Thank you, sir. So now from retina, we move on to oculoplasty. We have Dr. Rituja Thomas Grover, who has completed her post-graduation and fellowship from Narayan Nethralaya, Bangalore, and is currently practicing as a consultant at the Vision Eye Centers, New Delhi.
Thank you to Dr. Sneha and Dr. Aditi for having me again in the learner's basket this year. And in oculoplastics, actually covering a learner's basket is a bit complex because the surgeries are long and it's difficult to do it in 3 minutes. But I decided to rather go through a few scenarios which can sort of cover you and keep you safe in terms of oculoplastic surgeries, whether you're a general ophthalmologist practicing it or if you're a young oculoplastic surgeon. Yeah, so before you even go to a surgery, it's really important in plastics to take a picture. Otherwise, you have nothing to compare with, nothing to document. Even more importantly is to take consent, especially before taking photographs of the patient, and get important things done like phenylephrine tests to see if what surgery patients require. Do they need a fascinella servat surgery? Do they need a levator surgery? These things are really important. Even more importantly, do a cover test in any patient you're planning a ptosis surgery, especially children. So if a child has a squint, and if you don't correct the squint before doing the ptosis surgery, it could really be disastrous. When you get complex cases, don't be a novice and go ahead and do it. Ask somebody to help you. It's important to ask for help as well. Coming to certain intraoperative situations, in orbit surgery, if there's pupil dilation, it may be because you've injected with adrenaline, but if it is not, it's important to give steroids. Look for lid height intraoperatively. Look for things like tube breakage and slippage while you're operating. These things happen often. And post-operatively, it's important to manage hematomas really well. So get a good history, and even conducting, you may have motility restriction after orbital surgery, transient ptosis. So these are things which can be prevented with good dissection and performing the surgery well. And things like lower lid retraction, if they happen, you can treat it with 5-FU injections and steroids. This is something which happened to me actually. I didn't know it even happens. So this child underwent a really nice frontalis sling surgery with a good result. And over the days, he sort of developed a tube extrusion. So the tube had completely come out, but this was luckily managed well, where we could re-bury the tube and it healed again well. So patients who come for aesthetic surgeries, they are very anxious, so it's important to psychologically counsel them well, and as well as to counsel them regarding post-operative care. Regarding scars, you should know how to manage them with injections, and I feel the best way to learn is by teaching. So thanks.
Thank you so much for that presentation, Rituja. So to discuss this case, we have none other than Professor Rajendra Prakash Maurya, sir. He is the in charge of the Ocular Oncology, Trauma and Oculoplasty Unit at the RIO Institute of Medical Sciences, BHU. Over to you, sir.
Thank you, Dr. Rituja, for giving an overview of things which could go wrong when one can start the oculoplasty practice. And I look that you have done a lot of difficult cases. Although the oculoplasty practice in youngers by beginners is again very difficult. And you concern and assess the psychology of the patient, that's very good, while practicing starting the aesthetic practice. Thank you.